So the San Benito Health Project started in the year 2000, and they've been going strong now for 11 years. And in those 11 years, they've pretty much developed 6 areas of expertise. One of them is in oral health. They actually have learned a lot of dental procedures, the main one being pulling teeth, but they also make it out to all the elementary schools in the rural areas and apply fluoride to the teeth. Here in the States we have fluoride in water and nobody thinks about that. There in Guatemala they don't, and so it gets applied to the children's teeth twice a year. And the health team is beginning to see the results of that. They now have kindergartners who have made it to 6th grade who have received these fluoride treatments, and their teeth are in much better shape. Another area where they work at specifically is in women's health, and they do a lot of cervical cancer screening. They also provide prenatal care. The health team supports a network of midwives. They do a lot of training for them. Then you just have your general health care, which involves diarrhea, pneumonia, malaria. Those are the 3 big ones in the Petén. And then they have a whole area of chronic illnesses. So they are a big support to people who have diabetes, high blood pressure, and asthma. And by having regular contact with the different communities, they can provide these medicines for chronic illnesses. As well, anybody from the community can take the morning bus into San Benito and get off at the clinic if they need something special or in between visits. So it's a very extensive program, and definitely worth supporting. Their biggest category are the salaries, are paying the people that actually maintain the project. And when the team goes out to a community, there's usually a local person who's organizing that health activity for that day. They also receive a stipend for their day of work. Then the truck is a big expense, maintaining a vehicle and the gas and all the maintenance and all that with it. And then they also have a large section of medicine. We buy most of our medicine from Amsterdam that has a specific pharmacy that makes medicine that are safe, effective, and cheap. And that's where they get most of their medicine. They also buy some medicine in country in Guatemala. So that's another big chunk of their money. And then they have another little pocket of money called the emergency fund, because you can imagine that people that don't receive regular health care have an extraordinary large amount of health needs. So they actually have a little bit of an emergency fund to help families who have a health crisis. So just to speak a little bit to the accountability and the reporting of the health project, the last funder that the health project had really wanted the team to have an audit, and that was part of the money that he donated, was $1,000 a year for them to be audited. And we were able to hire a company in Guatemala that did a bilingual audit, and the team went through 3 of those and did very well in each one. One of the I almost think the most valuable player on the health team is the accountant, because he's the one who's able to bring in the receipts, put them under the right category, and keep a very close watch on everything. I had never thought of an accountant as being the most valuable person in the health team before, but he came out of a 2-year university program, and he has been just excellent at keeping everything in order, and I think that makes people who donate feel very comfortable that their money is being used as they had wished. And something that we give back to all the donors is there is a quarterly report done by Hudi, who is the project coordinator, and it's about 5 or 6 pages, and she lets us know the activities that happened over the last 3 months. I switch that into English, and I send that on to the funders.